Hi, I'm Lena, and I am a ESCP Robotic Fellow with Dr. Eloise Bin at Hospital Vall in Barcelona. I completed my surgical training in the UK, and my interests are in robotic surgery and endoscopy.
Hi, my name is Deena Harji. I'm currently an ESCP Intuitive Robotics Fellow at the Centre Hospitalier University Bordeaux under the auspices of Professor Quentin Nost. I also completed my training in the UK, and my clinical interests are in locally advancing recurrent rectal cancer, pelvic exenteration, and robotic surgery.
The reason why I chose this fellowship and this unit, I guess, can be divided into the patients, the people, and the place. In terms of patients, this is a colorectal tertiary care center with a range of referrals from around Catalonia. People, Dr. Eloise Bin is a leading expert in coloproctology and has trained in various centers around the world. He has extensive experience with robotic surgery and also training in robotic surgery. And the place, well, it's Barcelona, so enough said.
So I chose CHU Bordeaux because it has a global reputation for quality, innovation, and volume in rectal cancer surgery. The team discusses approximately 350 rectal cancer cases per year in their MDT, and they operate on 226 rectal cancers with a parallel watch and wait organ preservation program. They have a dedicated and mature colorectal robotic program with daily robotic operating and a dedicated colorectal robot. I came here specifically for the high volume robotic rectal cancer practice with the aim of becoming rapidly independent in TME and complex pelvic surgery. Clearly, my second objective was to learn robotic pelvic exenteration and pelvic side wall lymphadenectomy. I think in addition to that, there's an opportunity to learn many skills in these fellowships, and I've been able to do that through learning about complex pelvic exenteration with reconstruction, complex pelvic surgery, including redo pouches, retrorectal tumours, interstitial resection, low pressure laparoscopy, and an array of anastomotic techniques, including variations on coloanal anastomosis and anastomotic salvage techniques.
In terms of preparation beforehand, so I've already completed my CCT in the UK and am independent with laparoscopic colorectal surgery. I was fortunate enough to have access to the robot during my senior training years as well, and this included regular robotic operative sessions. I also had regular access to the robotic simulator and attended robotic courses.
Before I came to Bordeaux, I had performed 30 robotic rectal resections and I was an independent laparoscopic TME surgeon. I had experience as a robotic bedside assistant. I had completed my online training modules and my simulation training, and I had been on cadaveric training courses. In addition to that, I've also been taking French lessons for about 6 months prior to my fellowship, really with the aim to enhance my integration into the department and demonstrate that I was fully committed to every single possible learning opportunity available to me at CHU Bordeaux.
I think firstly, having to plan and go for a fellowship in the midst of a pandemic is quite challenging. Secondly, I found the language and cultural differences quite difficult initially, but with time, this has actually turned out to be a very rewarding experience.
The inevitable challenge is living and working in a different culture, which is made more complicated by learning a new language. The healthcare system is very different to the NHS, but adjusting to different ways of training and service delivery is rapid, and much can be done in advance to familiarise yourself with the unique local circumstances. Clearly, COVID-19 and Brexit have presented unique and unexpected challenges, but working in a near exclusive elective unit has minimised the impact of the pandemic, and the team at the hospital have been an invaluable source of support advice, particularly with regards to travelling, accommodation and regulation.
I have learned many skills, many of which include new surgical techniques, including robotic procedures. So I've had exposure so far to procedures such as anterior resections, abdominal perineal resections, CME, ventral rectopexy, retrorectal cyst excision, subtotal colectomies. And there's also, to mention a few, and there's also regular access to the endometriosis cases with the gynae team and the abdominal wall reconstructions with the abdominal wall team. In addition to robotic procedures, I've also had access to other laparoscopic and open surgical lists.
The fellowship has altered the way I think about rectal cancer, and I now have a number of additional strategies that will enhance my clinical and operative approach to rectal cancer and complex pelvic surgery. My robotic skills have improved immensely with the 50 cases that I've so far performed, and I've added beyond TME and soft tissue exenteration approaches to my skill set. I've learned robotic intracorporeal anastomosis and now teach other trainees the appropriate component parts of robotic resections, particularly left-sided resections, which include IMA and IMV, division, lateral mobilization, and stomach flexure mobilization.
So I would say that my fellowship experience so far has been meaningful and motivational with a great amount of camaraderie.
I would say inspiring, collegiate, and intensive.
In summary, we would both like to extend our thanks to ESCP and also Intuitive for giving us this chance to expand our robotic skills abroad.
We would like to extend a special thank you to Imran Aslam from the Education Training Committee for navigating us through the process of applying for these fellowships, and to Gianluca Polino for giving us the opportunity to be part of Robotic Colorectal Month.
Thank you. Bye.